Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk, seen on UVerse Channel 19 and WEYW19.com. I'm here with Dr. Andy Wasserman. Andy, early in my career, I worked in an office that were the team dentist for the Miami Dolphins. And they were big guys then. Of course, these guys are much bigger today, 30 some odd years later. But I found that the bigger the guy, the more anxious they were, the more fearful they were when they came to the dentist. What's your experience with professional athletes?
Well, I was the team chiropractor for the Florida Panthers from their inception for the first 6 or 7 years. I was hired by the orthopedist from the Cleveland Clinic. We talked a little bit. He had been referred to me, and we treated all the original Panthers, and it was a great experience. They're very compliant because they want to get better. They're professionals. If I told them to sit down and not skate for a little while, that was done. If I told them you're ready for the ice, and they went back and they worked with the trainer, that was great. They're ready to go. We had a great team in place. I worked in New York City for a little while as an extern when I was getting out of school, and worked on a lot of professional dancers. And that was a really exciting time because we worked on Broadway dancers in New York City. So that's a lot of fun. We had to see a lot of shows. And again, we worked on a lot of professional golfers on the PGA Tour, the Nationwide Tour, the Senior Tour, and some of the mini tours that are around here. I had the great chance to treat a great athlete, a great golfer from Spain. They may know Seve Ballesteros. Unfortunately passed away last year, but that was a real treat. Maybe one of the highlights of my career.
I'm sure.
Meeting an idol, I would say.
Years ago, my wife took me to the ballet, the Miami City Ballet, and before the ballet performances, Edward, whoever he was, would sit and talk to the audience. They would talk about the injuries that ballet dancers have. You would never think of it. You know, you see these beautiful, delicate people spinning and flying across the stage, and they're very muscular, but he was saying that the injuries are tremendous for his dancers.
Oh, yeah. I think dancers are the second most injured athletes in the United States. They dance 7 days a week. They usually do 8 performances a week. They work on a rake stage, which is a slanted stage, and they work tirelessly, not just to perform, but also to practice. And they've done it since they were little kids. So the life expectancy of a dancer is not really long, especially the women who are delicate, because their feet, their knees, their hips, their backs eventually, wear out. It's a very difficult profession.
You know, when I was friendly with the Miami Dolphins, my son wanted to play football. We were friends with Bob Matheson, and I called him up one day. I said, Bob, your son is my son's age, maybe 10, 11, 12 years old. And of course, his son was a lot bigger than my son. I said, you going to let your son play football? He said, Kenny, I'm not letting my son play football till he's 15 years old, because he was concerned about the injuries that his son may, what would happen to him.
Right.
So I got off the phone. I said, Seth, you can't play till you're 15. He says, okay. And I didn't hear from him again for another 2 or 3 years. But when he turned 15, I heard about it again. I've heard a lot of concern for chiropractics relative to ongoing care, whether it's a forever thing, not a concern, an issue, or different philosophies, whether there's ongoing wellness care. How does your practice approach that?
Well, we have a set schedule for everybody, and everybody's different. We have a beginning, a middle, and the end. In the beginning is the acute care. Most people come to us because they have some kind of pain. That's most of the patients. So within a 2-week period, we usually get that under control. After that, we try to teach these rehabilitative exercises over the next 6 weeks or so. It takes the body a little while to accommodate and acclimate to these new exercises, whether it's stretching, strengthening, balance, stability exercises, core stabilization, all sorts of things that we have in our rehabilitation facility. And then at the end, we give them a program they can do on their own, at their own gym, at their house, at their condo, wherever they like. And they can perform that over the next 3 or 4 weeks. And then we see that they're competent at doing their own little program. We let them go, and we tell them come back in either once a month for a little tune-up, especially if they're athletic, or come in when you need us. We don't have any long-term plans. We're on a tremendous amount of insurance plans. Almost everyone, HMOs, PPOs, Medicare, workers' comp. So we take care of almost any kind of plan out there. And plans are limited, but we have a very reasonable fee schedule. So whatever plan you're on, we usually can fit it to the budget and to the schedule.
Is there financing available for chiropractic care?
We try to, make it affordable for everybody. So if you could either have a co-payment, pay as you go along, or we could give you a set schedule program if you want to play on a monthly fee.
In our practice, we have patients who can pay over time up to 7 years. I don't do it, but we have 3 companies. We'll be back in a moment with Dr. Andy Wasserman. Andy, Dr. Kenny Levine, we'll see you in just a minute. Thank you.